how many people discovered after the diagnosis of IBS the specific problem it really was? Because I can tell you right now, just even looking at the data, okay, commonly, okay, co-diagnosis, misdiagnosed are people with celiac disease. A lot of people with autoimmune disease or celiac disease are misdiagnosed as having IBS for decades prior to realizing it was celiac disease, a problem with gluten. I'm going to use Kathy's case as an example. How many years did it take you to identify one of the main culprits of the IBS?
I was 22 when we finally started to turn around. So 10 years. Yeah.
And in your case, what was it? Was it anxiety?
It was hormonal, definitely hormonal. But there was also a food component, not that I was allergic to milk, but that I had lactose intolerance.
But there's more later.
That contributed to it. Yeah.
Right? So lactose intolerance is not an allergy to milk, guys. It's a digestion problem. Mm-hmm. How much training do you guys think your GI docs get on digestion? How many months, weeks, days, hours do you think your gastroenterologist or your naturopathic physician gets on digestion? Right? Because lactose intolerance is not a food allergy problem. Your allergist is going to laugh you out of their office. Okay? Not my problem. Can't be the cause of this problem.
Oh, yes. And so just another little tidbit, a little bit of data here. I went to a gastroenterologist, had the whole barium swallow thing done, all the workups. And I remember being very young, like 12, and telling the doctor that when I ate steak, I was okay, but if I ate a hamburger, I wasn't. And he's like, well, that doesn't make any sense because it's the same food. Supratentorial
syndrome you had.
Yeah. And it was only later, there was the lactose intolerance, but it was only later that I also recognized fat absorption problem, right?
She couldn't digest the higher fat of a hamburger versus a lean steak. Digestion problem again. Bing, bing, bing. Everything I learned about digestion, I learned after medical school, after 10 years of family medicine practice, on my own dime, on my own time, because I had those problems that I couldn't solve with all the medical training that I had, with it being zero around digestion. The only thing that we learned about digestion was in the middle of a pharmacology class. We learned what drug we should prescribe if anyone comes up with any of the IBS syndrome is Prilosec, which is to turn off stomach acid. That's the only, that was digestion training, okay? So anybody coming in with digestion problem, Prilosec, that's all we learned because it's all we had to learn. That's all we had to learn, okay? And to this day, when you even go to, you think going to a gastroenterologist, do you think they're the specialist in digestion? The only thing they're trained in is what drug to prescribe for the symptom that you have. So diarrhea, slow the bowels down. Constipation, speed the bowels up. Heartburn or bloating or pain, Prilosec, right? Turn off stomach acid. That's because that's the offer when you actually go see a gastroenterologist is they are the experts in knowing what drug to prescribe for the symptom that you have. It's what I call the fatal flaw problem. The fatal flaw in medicine today is the one symptom, one drug, one symptom, one drug solution. And that is the way that we train doctors about everything. And you can see how in IBS, it doesn't do the problem justice because it doesn't doctors aren't trained to ask deeper questions on what those underlying causes are. Kathy?
So I actually have a question for you.
Go
I know
ahead.
the answer, but I think this is a good question. Have you ever worked with anybody who only had the diagnosis of IBS and no other issues, no other health problems, no other anything, just IBS? That was the only thing on their big lung.
Never, ever, ever. And at this point, I'm like probably 20,000 patients in. And that's the fun of it. Okay. I think about myself as a medical detective. And if somebody comes and they say, my one and only problem is IBS. And yeah, we'll get the information about IBS, but I'll be asking questions nobody's thought about asking. I did it on this live. How many people have ever asked you the question, or someone with IBS, the question of, When did it start? Did it start during like puberty? Did it have anything to do with the pregnancy, certain times of the month, after delivery of baby, perimenopause? How about that, right? Melanie Tucker says postmenopause, right? Who the heck is asking you that question, right? Nobody. They're not asking that question. Now, somebody else is, like Kathy mentioned, she had to use Rolaids, and Jill mentioned she was put on proton pump inhibitors for 25 years. Like, that's one of the first questions I ask is going to be, you coming to me for IBS, what is your medication and supplement history with this? Because that's going to tell me a lot about how much of your current symptoms were iatrogenically, meaning doctor or pharmaceuticals created, right, as an underlying cause, right? So for me, that's 90% of population IBS. There's this whole drug-induced, or the bads that they use causing problems further down. Now, someone mentioned, we talked about a little bit about fibromyalgia earlier. How many people have these other narwhal diseases like fibromyalgia, POTS, right? Chronic fatigue syndrome, Lyme, right? SIBO. How many people have had these other diagnoses in their life, autoimmune diseases of any kind, all kind? And also have IBS. You know, someone comes to me and she said, oh, I got POTS. I got, let's say, dizziness or nausea or anxiety. I already know that the likelihood that person also has symptoms called IBS is at 100%. I really haven't met someone with, let's say, fibromyalgia, someone with POTS, someone with Crohn's or or rheumatoid arthritis, who didn't have symptoms or diagnosis of IBS, because what I call like associations, because they're connected, and in fact, they're the same thing. Can I tell you that IBS is just the bowel manifestation of some of these other diagnoses that you're going through? Could IBS be the gut manifestation of her menopausal problems, her hormone imbalance? Could that be the victim? And it's showing up that way as IBS. Could it be that her IBS is the victim, the gut manifestation of her autoimmune conditions, just another target of that autoimmune attack in the bowels? Now we label as IBS. You know, could it be that the IBS is a manifestation of too many medications and it's a permanent side effect of taking a medication for 10 years? That's the piece here. And the answer always is yes. IBS is never IBS. That's why I call it BS. IBS is always about something else. Have you guys, take that to the bank, please, 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 right? IBS is never about IBS. It's always 100% of the time about something else. So really importantly, one of the first things when people work with us is there's a link in chat, they book a call with our team, and they tell us about what's going on because I need data. And notice the information you're telling me in chat, and when you talk to us, I look at it as data, okay? Because that's helpful, right? And the way that I like to, and Kathy and I like to work with people, is we want to look at these problems and be like, let's look at what's the real cause of these problems based on this person's history. And for some people, it's going to be, wow, hormones was the really big issue here. For somebody else, it's their thyroid. For somebody else, it's their autoimmune condition. So I love to take all takers of impossible to solve narwhal diseases or chronic diseases and be able to get to know, get the data from you, what's going on. And I like to figure out what the solutions are going to look like for each individual person, right? So yeah, we can work with people online around hormone issues, thyroid issues, food digestion issues, food allergy issues, autoimmune issues, you name it. And I love the fact that we're able to do that online, collecting not just your data, but also your testing and data globally, right? So right now, I have one ask, okay? If there's anything that you learned from this today, is there a person, is there one or two people that you think could benefit from even 1% of what I talked about today? If so, click share. Share this video and share it with them.